maxillofacial surgery is a surgical specialty that's technically a dental surgical specialty. I always tell people that kind of bridges the gap between medicine and dentistry, because we do a lot of things that are more on the medical side and we do some things that are more on the dental side.
I work hand in hand with a group of oral and facial pain specialists, and together we manage our patients in a way that if they don't need surgery, we have a specialist for it. If they do need surgery, then we have a specialist for it. I spent a large focus of my training on perfecting my skills in TMJ surgery. In fact, I even taught myself most of the nuances within TMJ arthroscopic surgery, to the point now that I feel like I've perfected them, and I have such a passion for what I do and for my specialty that at this point in my career, there's a large focus on educating other surgeons.
Most oral and maxillofacial surgeons get some training in TMJ disorder when they're in residency.
I've got over 20 years of experience with TMJ surgery. I trained at a program that did a lot of TMJ surgery. I had completed over 100 total joint replacement surgeries, where most programs maybe do one or two.
We are a profession that treats disorders of the jaws, face, teeth, and mouth. That includes trauma to any of the bones in the face or soft tissue of the face. TMJ disorders, obviously, so any surgical or non-surgical intervention of pain or dysfunction of the temporomandibular joint.
While I was in my training, I actually began to experience jaw pain and headaches and neck pain I couldn't really figure out why at the time. So that was originally what got me interested in helping patients with TMJ disorders and facial pain and headaches, because I myself was at one point a patient. And so I went and did a residency in what's called orofacial pain. It's one of the newest recognized dental specialties.
The most rewarding part of my job, and the whole reason that I do this, is to try to help people. Just because we cannot see your pain does not make it not real. With that being said, once we identify what's going on and we find out where that source of pain is, if I'm able to help with that, that's the most rewarding thing. I've had people that come in that say, I've had this pain for 6 years. This is the first time I haven't had it. And that, to me, is the whole reason I do this job.
The most rewarding thing about what I do for a living is the fact that I can improve the quality of life of my patients. It's always special when I see someone years down the road and they thank me and share their stories on how they've really forgotten all about their TMJ. They're now focusing on the more important aspects of their lives, their family, their friends. And I think that's what gives me the joy of what I do.
I think one of the most rewarding things that we do as oral maxillofacial surgeons is to treat a patient who is in pain or cannot function and get them to a point where they can function and don't have any pain.
I think it's very rewarding to be able to take a complex scenario where a patient has migraines, got neck pain, got jaw issues, not sleeping well, and take that case and really be able to help them understand how these conditions are different and related, and then come up with an actual comprehensive plan.
TMJ disorder is interesting. You use that system so often. You use it when you talk, when you chew. You use it really probably more than any other joint in your body. And people, when they start to get dysfunction of that system, don't often realize how much it's affected their life. I've had a lot of patients say, I can finally eat a cheeseburger without any pain. Those things are great to hear, as a surgeon. I got into this because I wanted to help people, and that's one of the best ways that you can help people.
Can TMJ problems be overcome? 100% yes. That's why 90 to 95% of people only need conservative TMJ management.
I would say the majority of my patients, if we can get to them when the apparatus, the anatomy is still intact, we can get them to a point where they can function without pain.